Yeah, no, we wanted to keep the user experience really simple for everyone. So we just wanted the 300 words text. We didn't want any tagging. So they are sort of scrapes that we've done after they've put in their entry, to group them and to provide other users with examples of different searches they can use to explore the content. So it's our tagging, it's not the user's tagging. We did think about, you know, people being able to tag their entries, but we decided not to. We just wanted to keep it really simple, text only, 300 words, and then hit submit.
Thank you.
Mm-hmm.
Now, David has already answered Susanna's question because he's on the money, but over to a couple of questions for Irene. So, Buva asks, do your learnings from Spanish flu records inform the current pandemic records of the New South Wales government?
It certainly did. But if anything, we found that, you know, we don't, because we certainly look at what we've got at the moment. And I suppose it really depends on whether the historians find that the records, that the Spanish flu records that we've got in the collection is actually enough for them to sort of say that this is, yeah, this actually documented that time of the period. So, yeah, so we did find some interesting stuff in there, definitely.
Okay.
And I think we're really, we're actually quite happy to find them, because back then there wasn't any sort of a national approach or a state level approach into collecting stuff. So yeah, just happy that, you know, these records actually survive those.
So Irene, what was I've just got a quick question. When you were looking at the Spanish flu records, was there anything that surprised you?
I was certainly surprised that the actions that we were taking at the moment is very similar to what's actually been taken back in 1918, 1919. So I thought that was very uncanny for me. And I actually thought that surely there would have been a change in how we're dealing with a pandemic, you know, as opposed to how it was done back in 1918. And yeah, so I think the only thing that I thought I found was a gap was in relation to how it actually have affected the economy. So you can certainly see the records about the government response, the health response and stuff like that, but not so much about the economy. I suppose most of the stuff that we found were really about the compensation claims. So maybe that's the effect to the economy, I suppose.
Okay, thank you. Actually, a couple more questions for you, Irene, from Chris Colwell. So he's got a specific one here, which is the National Cabinet technically a subcommittee of the Australian Cabinet?
No. Well, this is actually an interesting one. We're actually in discussion with the other jurisdictions about how we're treating the National Cabinet. Certainly from the New South Wales perspective, we're treating National Cabinet as an intergovernmental committee, and it's not technically a cabinet within the federal cabinet, because at the end of the day, anything that they discuss in that National Cabinet, what's actually been implemented in New South Wales or in other jurisdictions still rests with the premiers and the territory ministers. So yeah, or chief ministers. So yeah, so it's not technically a cabinet or technically a committee, or how do you call it, a cabinet within the federal space. So it's intergovernmental relation cabinet.
Gotcha. Okay, thank you. So so some general questions from Joanne, which I think are interesting. I'm going to open up to the whole panel. So Joanne says, perception of people I'm engaging with is if you are running at 110% to keep up with the change, then it's hard to find time to contribute to records. How do we ensure that the stories of those the story that the stories of those that are continuing to evolve as a result of the pandemic are captured. So I think there's a kind of a general question here around how you find low impact ways of collecting this, of collecting these records that I think all three of you have been working through. Joanne also says, how do we learn from the data that we're collecting? Which again, I think is a great question. So, David, do you, particularly with perhaps the learning element, how best do we learn? I think you're on mute.
Okay, so firstly, if people can get real-time feedback of other observations like theirs from equivalent professionals, they're likely to contribute. I mean, particularly in a medical environment, because peer-to-peer knowledge exchange is part of what they're about. Yeah. The way we allow them to, because we don't do tags based on categories, we use what's called high abstraction metadata. So literally people are positioning their narrative into 6 triangles on a screen and then moving on. So we make it really fast. And that's also designed to prevent them to actually detect weak signals. It's designed to get people to think differently about the problem. So one of the things they can do is, you know, if I had an answer to this problem, I would index it like this. And then the system finds anything that anybody else has indexed in a similar way. And that allows what's called serendipitous encounter, which is the way people in the field like to discover things. They don't like doctrine, they don't like structure, they want genuine original material. So that's one factor. The other is naive observers. So we've deployed, for example, trainee nurses, trainee medics to act as journalists by shadowing experienced medics, because that's then also part of their training. So you get a double benefit, yeah, in terms of the way it works. And that was originally pioneered in the North Sea, using engineering students onto engineers. Yeah. So using indirect observers is part of it, but you've got to allow real-time feedback loop. I think the other thing is anybody who contributes, we then engage in the interpretive process. So the interpretation isn't handed over to statisticians or curators. It's a distributed interpretation process in which conclusions are presented and represented to large numbers of people. And the visualization techniques then allow us to identify outliers. And this is kind of like key in a pandemic. It's the famous experiments. If you give radiologists a batch of x-rays, ask them to look for anomalies, on the final x-ray, they put a picture of a gorilla, which is 48 times the size of a cancer nodule. 83% of radiologists don't see it, even though their eyes are scanning it. Right? And again, this is one of the major issues with curation, is you tag data based on what you expect to see, not what's really there. So one of the things we focus on is finding the 17%, finding the people who have seen something that nobody else is paying attention to. And that's kind of like the direct observation, real-time nature of data. And we use fitness landscapes for that, which look like contour maps, which can identify where there's consensus, where there's difference, where there are people who are thinking differently, and do it in real time. I think that's key. The visualization is vital to this, yeah, which Paula also made that point.
Yeah, look, I think it's, you know, you touched on a few points there that are very prevalent for us in terms of the diary files, is that real-time feedback, you know, cause and effect, which we do pre-moderate the entries, but we try and do it within the next day so that people can see their stories coming through. We don't give preferential treatment to anyone's stories. It's just whoever's next comes in line. So you can either read through the stories in a kind of serendipitous way and just, you know, come back each day and look at new stories, or you can go through the tagging and just hone your search and look for certain topics there. I think also the point about you know, the dashboard for us and the data viz that David's just brought up is kind of important when you do these kind of, you know, these real-time participatory projects, because we need to learn where those sort of gaps are within our audiences and who aren't we reaching and why aren't we reaching them. We're trying to collect the stories broadly across New South Wales. So if we can analyse the data and look at some of those gaps, then we can address those while we're still actively collecting this material for future generations to research, you know. And you know, we can look at those age groups, we can look at the kind of terms that are coming through. So I think, you know, it's important for us to analyze our data in that way as well, and we make that public so that other people can look at it too.
Well, I think from our perspective, because we collect about what, you know, the government is actually creating as records, so for us it's sort of, it has that lag time that we need to actually wait until a particular event has happened. So it's basically sort of like more on the post-COVID side of things. Then that's when we basically get these collection from.
Okay, thank you everyone. So some more questions. So there's another interesting one from Joanne, which is, so given what's happening in Melbourne right now, how can we deploy what we've learned to help those affected? Any thoughts on that?
We've got the opposite problem. We're going to have to do that in our cities. So, I mean, it's quite interesting. I mean, there's a huge difference in treatment between Wales, England and Scotland. So Wales is going for progressive lockdown, releasing one thing every week. Whereas Boris went for everything suddenly last Saturday, and we had everybody congregating outside bars in London. So we're going to get a massive second spike in about 2 weeks' time. And we also had sort of near slave labour in parts of Leicester, where people were forced to continue working during the crisis in unsanitary conditions. So now there's been a Leicester-based close down. So I think one thing you're going to see is increasing progressive close downs of towns, cities, areas, or blocks. Melbourne's the first one to close down a block. But that's going to be common, I think, at least for the next year. I can't see that changing until next year, particularly given the attitude of countries like the US, which are going for herd immunity. I mean, UK and US are going for herd immunity, which I think is ethically dubious. So I think we need to get recording systems into that, and that's our focus. I mean, I said about 8 years ago, if we had every child in every school in the world act as a journalist to their own communities, which is our big plan on this, then it would be hugely useful in the event of a major pandemic. So people are now starting to pay attention. Yeah. So you need to get people in those lockdown tower blocks, don't need to be recipients of communication. They need to have multiple methods of feeding back to you, which are structured, and you can't rely on social media because social media is a corrupt environment and it's also corrupting. So starting to move people in, get some of them to be diary keepers, get some of them to be observers and reps, give them access to the data themselves so they can see other people's narratives. And you need to do that fast, and nobody's doing it. They're just treating it like they're, I mean, my father was a veterinary surgeon, all right? So I lived through brucellosis and tuberculosis eradication, yeah, in which basically, to be honest, you slaughtered everything with a disease. Well, okay, we're not killing people, but we're treating people like animals in the lockdown. And we should expect an animal response if we don't change fast.
Yeah, you touched on an important issue for us there, David, in terms of providing a platform for people outside of social media. We specifically did not want to set up the diary files just through Facebook or, you know, some kind of Instagram. I mean, we are collecting that stuff anyway, but it was more about giving people a trusted platform, which is, you know, built and hosted by the State Library of New South Wales. We know our audience have this, you know, trust through the previous project that we did with New South Wales, and that they feel they can be more open potentially on this platform rather than it being on, you know, Facebook. But again, I think, you know, what's happening in Melbourne now is we need to capture those stories from people. We need to somehow reach them and invite them to participate and tell us what is going on in this second wave. What are the realities for you know, families, for teachers, for students, for healthcare workers, for everyone, so that we can capture that moment and provide it in, you know, in many years to come, which, you know, social media potentially won't be able to do.
I think it's just to throw in peer-to-peer is critical. I mean, we were about to trigger a major project on diabetes 2 reversal before all this hit, and we'll come back to that. But we know from personal experience, as well as from the literature, that people are more influenced by stories of people like them than they are by stories of experts. So it's not just recording the material, it's connecting people. And it's connecting people very quickly and providing those sort of mediated services. And the interesting thing is you get better data as a researcher or a government official out of looking at things sideways rather than asking people direct questions. If you ask people direct questions, all you get is what they think you want to hear.
Yeah, we definitely saw you know, a spike in if there was entries coming in that was poetry based, then there would be more poetry based entries. You know, if there were people talking about, you know, frontline healthcare workers, there would be more stories coming through from frontline healthcare workers. So yeah, we've definitely experienced that with the diary files.
There was an important point Terena made as well, which I think is worth picking up on. Yeah, sorry, there's some background coming in here. If you're going to do this sort of work, then I mean, the real time is important, right? But also there's this question of what you reflect on in the past, because one of the reasons we had the major problem in the UK, and they had the same in Melbourne, is people hadn't seen COVID. I mean, I'm watching horror stuff coming in every day. Yeah, I mean, there's some really nightmarish things. It's not a good way to die, and yeah, the secondary effects will last for years in some cases. But people haven't encountered it, you know. So when they came out of lockdown, well, it's not a problem. I'm okay. And you've got the false media sites which are telling people not to worry, their immune systems are fine, it's all a scare story, etc. It's actually quite interesting. We were doing some work on the rise of fascism, and we ran a program across Wales which was actually using cabaret as a school subject. Because remember, cabaret as a movie is about the rise of fascism. And if you look at what happens in the medieval plagues, anybody who's got the money leaves the cities for the countries fast. Yeah, because they're able to do that, and then they spread the plague more. And I think that sort of indirect learning and starting to create study programs and letting people make those leaps for themselves will help them understand the reasons for it. I mean, the stories of the plague villages in the UK, there's one above us on the hill, where the village voted to lock the village down. They knew they'd all die, but they didn't want to spread it. And there are deserted villages all over England and Wales where people made those sort of decisions. Yeah, and I think we need to allow people to learn and see things from multiple perspectives, you know, really quickly.
So I want to pick up on one of the themes there, and I want to kind of drop us, say, 2 years into the future. And let's say we've found a vaccine for COVID. What's different? What are we doing differently? And what have we learned from the pandemic that we're actually applying to things that aren't COVID related? And I appreciate that you've already said something about this, David, especially regarding diabetes. But Paula, so perhaps starting with Paula or Irene, what are we doing? How has this event informed our everyday practice?
I think for, us in the library, building the diary files and all the stuff that's going on for us in terms of collecting is the ability to act quickly, be responsive, to turn to our communities, early on, and to get their stories in any way we can to add to our collection. So we've done 2 massive community participation projects in the last couple of years that have given us rich material. I think that, for future historians, for future researchers, that material is going to be so valuable when they're looking at, the traditional catalogue collecting that we do alongside, the Born Digital, is that we're getting the voices of the people generally of New South Wales to tell us what is going on in these historic moments. So I think, being responsive, trying things in cultural heritage, particularly with digital online, is something that I'm seeing the sector do a lot more now, working really fast, looking at alternative ways of working. I think that's been really important for our sector. And also just getting those voices through in real time, as Dave said, it's really valuable.
Yeah. And from our perspective, it's like Paula has said, it's really about being responding quite quickly. It's actually making sure that we put out information as much as we can with regards to what records do we want people to actually start creating, or if they are already creating it, start thinking about, are these the records that, probably the future generations would want to see or would want to learn from. And it is quite hard, because I think sometimes, of course, when you're working and stuff like that, from a record keeping perspective, you don't really look at, oh yeah, these are the records that, probably would be of significance later on. So that being proactive has been something that we realize that we need to do that a bit more, and start sort of, communicating and engaging with the agencies as well, and or public officers, just to make sure that they are doing the right things, and that they're going to start, looking at tagging actually, or identifying which records will be required as state archives at some stage. Because for us at the moment, we know that the whole of government response will be collected, because they are going to be required as state archives. But we're also looking at, like I said before, the internal agency response. And it's not just from a whole of government response, but really what's actually happening internally between these agencies, because there have been changes on how we're working, all of the social distancing measures, all of the flexible working, and how that actually affects workplace practices in terms of equality and equity and stuff like that. So, yeah.
I think, I'd have 2 hopes. One is that people have made the connection between COVID-19 and climate change. And of course, your federal government is amongst the worst offenders in this respect worldwide, although we're not much better, all right? But if people can start making that connection, that will be a positive benefit. I think we're also starting, and it was interesting, the original study I did in Kakadu in the 70s was on gifting in Aboriginal communities. And gifting is an entry fee, not an exchange mechanism. So if we can start to work on economic forms based on gifts rather than exchange, which is why I don't like blockchain, because the minute you have a means of exchange, whoever owns the means of exchange has power. So those would be 2 positive hopes. But I think also we need people to get politically active very quickly, because the dominant pattern post-plague, post-major economic disruption, is patriarchal feudalism. And that's what populist governments are playing. Right? And I'm actually more afraid of the political consequences of COVID by people not paying attention than I am of the actual disease consequences. And we need people to think about that.
Thank you. Okay. Everyone, last chance for questions, please. Okay, so question from Chris. How do we turn a passive collector into a proactive provider in the future, because we now have it in digital formats? I.e., how do we push the information as we know we have it?
You reduce the burden. What we did with the US Army is we basically said you don't have to write a patrol report if you keep your diaries up to date in the field. And we got 100% compliance. And this has been a golden rule of knowledge management for the last 3 decades, and people keep misunderstanding it. If you want people to give you half an hour, you have to give them 3 hours back. Nobody will do something now on the promise that their life will be easier in the future. So I mean, some of the stuff we're doing with NHS in Scotland at the moment is on, can we replace the real-time capture, which gives us more accurate data? Can we use that to replace some of the bureaucracy of control? So can we increase the objectivity through participation rather than by traditional bureaucratic controls? And I think that's one of the areas government should look.
Okay. Paula and Irene, how about the distribution of information as well as its collection? I mean, obviously, Paula, you've been doing work with the ABC.
I mean, I think it's about looking for those partnerships that can, you know, get the kind of response, you know, the cause and effect really quickly. Obviously, that partnership with the ABC for us really drove content because, you know, they were being read out on the radio every morning, and that was a great benefit to us. So I think looking outside of some traditional partnerships, I mean, the fact that we built that website in 2 weeks, you know, the ABC were wanting to do the same thing as us, but they didn't have time to get that website together. So again, you know, responding quickly, building something, you know, simple in terms of its design, allowed us to kind of marry 2 needs. They wanted to do the same thing. We'd already done it, so why not partnership? Don't replicate and build the same thing. I think that, you know, we just need to try these things in the sector. We need, if we want to start collecting from our audiences to gain a different perspective of a moment in time, we need to encourage them. We need to ask them, and we need to provide something that is quick, responsive, and available, and something that they can then reshare as well. So we need to look at how we effectively make this content available in, you know, 2 years, 5 years, 10 years, 50 years. So I think that's going to be one of our challenges next. Yes, we can, you know, archive websites and but born digital is a huge issue for us to look at in making extremely responsive, like available now. We can collect it, but it is the hard thing about making it accessible straight away. So I think it's something that we really need to start working on.
Mm-hmm. And it's the same with us, trying to make this information or even the records available or accessible. We still have to get the records from the public offices or from the jurisdiction. And then second, usually we do have the State Records Act that allows us to sort of have those access directions in place. So I think for state archives, we are bound by the Act because at the end of the day, we are collecting the records of the state, documenting the New South Wales government's activities and functions. So at the end of the day, we do have to look at those access provisions. So from our end, it would take at least 30 years because that's what the Act says in terms of once the records are transferred to us. but in saying that, if it's already open, then we actually encourage agencies and public officers to actually have their records be published on their websites and to make it accessible.
Thank you. Okay. I think we're going to kind of wrap it up now. It's been an excellent session. So some great input from the presenters and some great questions from the participants. I'm going to give each of the presenters an opportunity to make a last comment before we finish. So, Irene, do you have any final comments or thoughts or reflections?
I think for us, certainly there are certain things that we do want to collect. And I think because we're still bound by the government and the State Records Act, so it takes a while for us to sort of make some actions or decisions, but we're trying to be really proactive in this space. And then we do want the public officers and also within the jurisdiction to actually let us know exactly what they think should be required as data archives. Because at the end of the day, the stuff that we've got on these retention and disposal authorities, they do relate to the whole of government response. And if we want to provide a more holistic collection or what we're going to have in the archival collection, then it will be good to get those voices in as well too. So yeah.
Thank you. And Paula.
Yeah, look, I just want to touch on the fact that you know, that we took a risk with putting something out, you know, so quickly. It is what we do in the lab. We publish, we test, we try, we fail, we learn. But I think it's important that we were given that opportunity to quickly publish something that allowed our community to connect with each other, but also to connect with the library in that way, to tell us their stories, and that we were able to, we're almost at 1,000 now. We'd love to hit, you know, more so that we can gain a broader sense of what is happening over a longer period of time. But this was a real experiment for us, and something that we just tried. So I'd like to see, you know, more of that happening. I think there will be an appetite for that more now in the gallery, library, archive and museum sector, and that, you know, we've just gained such valuable stories from our community, and I really thank them for putting such amazing work into putting those stories in there.
Thanks, Paula. And Dave.
Yeah, there are 3 basic rules we got in the new EU Field Handbook. So one is you distribute decision making, but you centralize coordination. That's kind of like a golden rule in a crisis. You have to make decisive decisions quite early to force a situation out of chaos, but you do those to keep your options open. Yeah, the minute you do that, distribute decision making, centralize coordination, you can't make decisions because you haven't got the energy or the connectivity. You need to focus on centralization, and that works at different levels. The second is peer-to-peer learning. You need to get people engaged in peer-to-peer exchange really fast. Yeah, it mustn't be mediated or curated. Yeah. And the final one is communication by engagement. If people are engaged in understanding the problem and coming up with solutions, you'll get better data than if you treat them as passive research subjects or people who have to be communicated to. So those would be the 3 rules. And in that context, observational data as opposed to narrative, you would really be looking to get 5 or 10% of the population keeping daily diaries. Yeah, and acting as observers into their communities. And if you think about the volume on that, it's very difficult for a politician to challenge it. A politician can challenge other material, but they can't challenge that level of engagement. And that's kind of like key.
Thank you very much. So if the if the participants can join me in thanking our presenters. And thank you very much to the participants yourselves for making the time to come here. As soon as we have the recordings, I will make those available. Yeah, it's been a really good session. So thank you once again, and good night.
Thank you.
Thanks, Matt.
Thanks, Matt.
Thanks.
Yeah.